Welcome all. Today we are going to talk about a particular condition which is actually called the imagination of doctors, researchers and also press media across the globe. And all of us are interested about this particular virus that is known as coronavirus. And this is noticed in the last day of last year, that is 31st December 2019, and this is known as coronavirus. Then after the death of a patient, the specimen is collected from the other patients which having showing the similar symptoms, and this is the electron microscopy picture, and this is very important picture. This can be image based question in the upcoming examination, PG entrance examination, or this particular features can be asked in your EMQ examination also. And you can see here around the periphery there is a bulbous projection. There are bulbous projection, and these are the proteinaceous molecules. These are the proteinaceous molecules, and that is where which is resembling the solar corona also, and that is from where the coronavirus name came in. That is why this is known as coronavirus. Few important points regarding this particular coronavirus. Before going into that, we will give you a MCQ also. See this particular MCQ. That is, hemagglutinin esterase is seen in. There are 4 options that have been given out here: alpha coronavirus, beta coronavirus, delta coronavirus and gamma coronavirus. So you understand there are 4 genera of coronavirus. That is very important. You should remember them, because the question in future can ask from any of them. And we are going to talk about the important features and important aspect of coronavirus. Then you will have a pretty clear idea. But what is hemagglutinin esterase? You are seeing this bulbous projection, and this bulbous projection is actually very short in one of them, and that is beta coronavirus. Beta coronavirus, and that is also known as murine coronavirus. Okay, that is known as murine coronavirus, and that is actually known as hemagglutinin esterase. This can be your future question. No need, they will ask you about the symptoms and sign. They can, like in GPMAR or AIMS, they can give this sort of hemagglutinin esterase, which is a integrated question with the image based question. They can easily ask about this particular facet. Though beta coronavirus not generally affect the human beings, and that is where the beta coronavirus actually not affecting the human beings, is a murine coronavirus. So few important points. We first should talk about coronaviruses. That is one. There are 4 genera that we have already have told you. There are 4 genera of coronaviruses. Four genera of coronavirus: alpha, beta, gamma and delta. Now 7 types of coronavirus actually affects human. 7 types of coronavirus actually affects human. There are 3 known epidemic which is known till date. First of them is SARS, which occurred in 2002-3. Next in line is Mars. Mars stands for Middle Eastern Respiratory Syndrome, which have occurred in 2012-13. And the recent one is termed as NCOV 2019. This is novel coronavirus with the first case occurred in 2019 and the epidemic is continuing today, 2019-20. So these are the three known epidemics that has affected human beings. And the SARS is actually known as severe acute respiratory syndrome. So by now we understand the predominant symptom that has occurred in human being is the respiratory syndromes. Respiratory syndrome. But this is not the only place where this particular virus is affected. Other people, other animals are also affected. It is not only affecting human beings, it is also affecting other animals, including the birds, it is also affecting the birds, and the hen. There are chicken infections which have been reported earlier too. It has affected the cattle. Obviously, I'm not going to get prize for drawing as Michelangelo or Leonardo da Vinci and the human. So all three of them, other animals are affected, humans are affected, and birds too are affected. And another species that is also affected is bats. It's like affecting the Batman. Bats are affected too. Bats are actually associated with many other recent virus infection like Nipah virus. They are associated with quite a few virus infections spreading of recent epidemic. Bats are associated with. That we most probably noticed. The Nipah virus was a question in recent AIMS examination. So as per now, what we understood, it is not only affecting human being, it is affecting other animals too. So there is a chance of having zoonotic infection. Zoonotic infections, which is very predominant chance. Most important thing, we have to remember, most of the treatment doesn't give, most of the cases which are affected by the virus doesn't give any alarming symptoms or signs. So most of the cases are asymptomatic. Most of the cases are asymptomatic. If the question is which is the most common symptom, asymptomatic is the option that is going to be the answer of the question. This is very important one-liner. And we already have talked that it is affecting the respiratory system and GI system both. One interesting thing about SARS, it is not only affecting the upper respiratory tract like trachea, larynx and all, it is also affecting the lower respiratory system. This is the SARS, the unique feature, it is affecting upper respiratory system plus lower respiratory system. It can be an important MCQ point. Because this particular topic is so very catchy, you can expect in 2020 there will be 2-3 MCQ can come up from this. Till now we have not have any vaccine, no vaccine, no drug of choice have been selected yet. No vaccines and no drug of choice have been selected yet. But as we have said, most of the, even among the symptomatic patients, most of the patients, human patients are giving very moderate, mild to moderate respiratory symptoms. Chiefly mild to moderate respiratory symptom. It is going to be mild to moderate, not severe. But among the severe respiratory syndrome, most lethal is pneumonia. Most lethal is pneumonia, and alongside pneumonia, other thing that is seen, that is bronchitis. We already have mentioned SARS. Actually, in SARS, we have seen the cases which is affecting upper and lower respiratory system both. Alongside that, there will be GI symptoms can be seen. So these are roughly, this is the thing, though it have been actually circulated in the media, so many cases are affected and so much things are happening all over China, so many hospitals are built, but most it is said the most respiratory, most person actually in their lifetime once being affected by this coronavirus, once being affected by this coronavirus. So it is not as alarming as it has been projected yet. So there is no need of that much severe concern. You should be prepared, but should not be panicked. Now, one easy question that can come, and it sounds easy, but whenever you are going to give the examination, the situation may not be that. The answer is actually in the name. It is a RNA virus. You just get this O off. This is a mnemonic point. This is actually a RNA virus. Now, if you think of a GPMAR or AIMS examination, they will be asking the very specific question. So it is going to be single strand RNA. Again, make it tougher. It's a positive sense single strand RNA. Again, make it tougher. Another important point is a enveloped RNA. So from microbiology angle, these are the questions you should remember. It's enveloped. What is the investigation you will do? You will do electron microscopy. We have shown you the image, and you can do the PCR also. Polymerase chain reaction. So we have tried. Till now we have to give the treatment, and treatment is very important, because integrated medicine discussion cannot be over without it's a symptomatic treatment you have to give with the basic support systems ready, so that life is saved. You have to give the symptomatic treatment. Depending upon the cases, you have to take care of the respiratory symptoms, and thereafter keep the resultant treatment. So there is no need of panic. This can be controlled, and you have to make sure that you will make your hospital should have the infection control protocol ready. This is very important, and also very important that you do frequent hand washing. You know, hand washing is such important for controlling the infection. Hand washing. And also you have to put a mask on, so that you are not spreading the infection. Put a mask on. This is very important. You make sure you are not spreading the infection. These are the infection control mechanism that should be present in your hospital. And all these points, if any question come, not only in the MCQ or extended medical questionnaire like MRCP pattern or USMLE pattern, then also you even in MB, if there is a short note in the microbiology or in the medicine comes, you will be able to give a if you are mentioning all the points, you are going to get the full marks. Even in your viva, if this particular question regarding anything being asked, nothing will be till date, nothing more than this have been mentioned anywhere in any scientific documentary or any publishing. Nothing is mentioned till date more regarding the coronavirus, apart from what have been stated out here. And another important point, this is one of the largest RNA virus, so it is very important you remember all these MCQ points. We most probably have tasked around 10 to 15 MCQ points, and any of them can be your future MCQ. At the end, before going out, we just go to show you the image of the coronavirus under the electron microscopy, and you can see the shape resembling the corona from where, and it is the bulbous projection, and it is made of the protein. And this is the part where it is actually involved in the host tropism. These are the terms are very, very important. You should check those things from your microbiology and pathology books. These are future MCQ points. We are not going to tell more than this. We are going to have our classes, and there we are going to talk about in detail. But I think it's a pretty longish lecture till now. It's almost 19 minutes. And lastly, we see the question once more. This is a very important question, and this can easily be the question. After knowing all this, also you can make it mark it very wrongly. And here the hemagglutinin esterase is seen in, and it is seen in beta coronavirus. The projection, the bulbous projection, is shorter in beta coronavirus, and there the hemagglutinin esterase is seen. That is, it is shorter, and that is known as hemagglutinin esterase. Thank you for seeing this particular video, and if you are really interested and finding it helpful, please let us know in our Facebook pages message boxes. We'll get back to you within 72 hours. And regarding our future presentation, where we are going to give our future presentations, we'll let you know for sure. We are very impressed with the kind of support that you have given us, and we really value that. Thank you. And at the end, we are showing you our presentation in YouTube, and really strongly urge you to follow our YouTube channel. We are uploading the videos where we are not going to do it as frequently as we used to do, and but because I'm actually being very busy in upcoming 3 months, but we are surely going to upload a few with the increasing interval. But like that we did in the AVD video, you can understand what is the difference between the just a question answer discussion and the AVD video. AVD video we go detail for this particular topic, and if you like this presentation, stay with us in the Facebook, Twitter and YouTube. Thank you.